So what is Henoch-Scholein Purpura, and what are you going to answer if somebody asks you about this condition? To have a better understanding, you must have the core knowledge about the underlying pathology of this condition. Remember students, Henoch-Scholein Purpura is an autoimmune disorder. The exact cause is not known, but usually it follows an upper respiratory tract infection, as we studied in the case where we had a child who was suffering initially from a sore throat. The incidence of Henoch-Scholein Purpura in children is approximately 6 to 22 per 100,000 persons per year, which is higher than in the adults. That is almost 3.4 to 14.3 per 100,000 persons per year. So it's more common in children. And another factor that you have to keep in mind is that the males are predominantly affected with this condition. There is also an association with HLA B34 and HLA DR B 1 allele 1. This is through some research studies which have been conducted. Henoch-Scholein Purpura is a feature of the genetically determined anti-inflammatory disease, familial Mediterranean fever, and indeed Henoch-Scholein Purpura occurs in approximately 7% of patients of these suffering conditions. Different studies from some specific regions have shown a significant increase in the prevalence of mutations involving the MEFV gene. Now, the cause of this familial Mediterranean fever in children with Henoch-Scholein Purpura compared with the prevalence of MEFV mutations in the general population is not quite yet established. The most notable finding is that familial Mediterranean fever is characterized by neutrophil activation and intense neutrophil migration to the serosal surfaces. Attacks of familial Mediterranean fever are effectively prevented by colchicine, which is a drug that inhibits the neutrophil activation and migration. Now, if we have a closer look, histologically, Henoch-Scholein Purpura is characterized again by the same intense neutrophil activation and infiltration of the small vessels. So this can be a correlation between these two diseases, that is the familial Mediterranean fever and the Henoch-Scholein Purpura. Anecdotal reports suggest that colchicine may have a role in the treatment of Henoch-Scholein Purpura as well, but it has not been studied in a systematic fashion yet. Polymorphisms in a number of genes encoding pro-inflammatory cytokines, cell adhesion molecules, and molecules associated with endothelial cell activation have also been studied. Till date, most work has been focused on factors such as tumor necrosis factor alpha, interleukin-1 beta, transforming growth factor beta, and vascular endothelial growth factors, and polymorphisms in their respective genes. Virtually all the studies suffer from relatively small number of patients. However, at this time, no confirmed conclusions can be withdrawn concerning the polymorphism in the cytokine genes and the genetic susceptibility to Henoch-Scholein Purpura. Some of the studies also suggest that there is also an increased risk with the periodic fever and the protein C deficiencies. The pathogens which are mostly associated with these conditions include Group A, beta-hemolytic streptococcus, which has been widely studied and found in almost 20 to 50% of patients with acute Henoch-Scholein Purpura by serological tests or bacterial cultures. Bartonella henselae, which was found in almost 12 to 18 patients of Henoch-Scholein Purpura, where the sera was found positive in these cases. Other Henoch-Scholein Purpura associated pathogens have also been reported, such as Staphylococcus aureus, Helicobacter pylori, Haemophilus parainfluenzae, Coxsackie virus, adenovirus, hepatitis A virus, and hepatitis B virus. Now, how would you consider an autoimmune reaction or autoimmunity? It's basically when the immune system is activated against the body's own vessels. So you see, it's a self-destructive process that starts against one's own self. The vessel walls gets damaged, resulting in the leakage of the blood that causes that particular rash which is seen in these children. Blood vessels in the intestines, joints, and the kidneys are also affected in these patients. Bleeding in the stools and the urine can also be found in such cases. So now we know the underlying mechanisms to how this clinical picture is being found in these children, the rash, and what are the causative organisms which are basically contributing towards the formation of this clinical picture. So now let's see what are the signs and symptoms that we're going to look for in this patient of Henoch-Scholein Purpura. What would be the red flags that we would look for in such patients, the points in the history that we'd cater for, and how are we going to move about with the investigations.